I am Tanasha Woods, chair of this wonderful organization, and that was my full on-fledged welcome to everybody. Thank you for attending. Thank you, our panelists, for accepting the invitation, and I look forward to a really good conversation, informative conversation for our viewers. And now, our vice chair.
Hi, everyone. Adele McClure, and I serve as the vice chair. And really happy to have you all on to talk about housing barriers and issues that have been exacerbated during the pandemic. And so, if I could just get you all to introduce yourselves and also talk about some of the roles and programs and services that your organization provides. And so, if we can just start with Kube.
How did I know you were going to call me first? um, good afternoon, everyone. My name is Kuba Ngaje. I'm the executive director for the District Alliance for Safe Housing, affectionately known as DASH. And DASH is the largest safe housing provider for survivors of domestic and sexual violence in the DC metropolitan region. And I'm really excited to be here with you all and looking forward to a great conversation.
Amazing. And then next we have Rondalyn.
Good morning, just a little bit still for some of us. My name is Brondalyn Coleman. I'm the lead consultant for BNC Global Consulting. We are based out of Oklahoma, but I also do contracts in the state of Texas. And our specialty and focus is working with those that are underserved in a variety of areas, but focusing on homelessness within the veteran population. And so I am excited to be here with you guys and to share any nuggets and pick up any nuggets I can take back. But this is a really big topic that definitely needs this insight and information that I think we can bring today. So thank you for having me.
Thanks for being here, Brondalyn. And then next we have Naya.
Hi, good morning, everyone, or good afternoon. My name is Naya Kelly. I am the Director of State Legislative Policy, Equity, and Transformation at the Chicago Coalition for the Homeless. In my work, although we are the Chicago Coalition for the Homeless, I actually do our statewide work. So working on the state budget, as well as moving legislation that removes barriers for people experiencing homelessness. We're not a traditional service provider, although we do have a law department. A lot of our work is around advocacy and organizing, and with this idea that like housing is a human right and everyone deserves to have a place to stay. And so kind of moving our work on this like global scale of like ending homelessness here in Illinois. And it is great to be here today.
Thank you so much, everyone, for those introductions. And we're going to jump right into it. So I did want our vice to begin, but I'll go ahead and give out this first question and we'll just go back and forth, if you will. All right. So you all gave just a little bit of a description of your roles, but if you could go into a little bit more as to the programs and services provided by the individual organizations that you work with. And we can start with Naya this time.
Awesome, thanks. So as I said, we have our law department, and our law department takes a lot of cases. So there's a couple of wings of our law department. We have an education piece where we have students under the McKinney-Vento Act, which is the federal act that ensures that students who are living in temporary living situations, so couch surfing or living in shelters, are able to get the services and supports that they need while they are in school. So if you're living in the city of Chicago, making sure you have access to a bus pass. If you're maybe in a rural area, having, if you're staying at a shelter, making sure that the bus, school bus comes to the shelter to pick you up, making sure that you can stay in your school of origin, because even though life can be a little bit of chaotic, having, your same school, being able to see your teacher every day kind of grounds kids. And so we take a lot of cases where schools may attempt to push out these students and say, no, you need to start going to the school that's in the same district as your shelter. We also do class actions. So we have had to sue municipalities around just like panhandling under the First Amendment, or making sure we have an Illinois Homeless Bill of Rights that was passed through the work that happens in my department, and now our law department is able to take that and use it to make sure that just because you're experiencing homelessness doesn't mean that you are treated any less than others. And then in my department, it's really, it's kind of, we work in a cycle where something happens within the law department, and then we need to, like, it's not just this one person, it's that triangle, like it happened to that one person, but we can find like 30 other people that this is happening to. And so pushing legislation down in Springfield and making sure that we're getting funding for all of the homeless and housing services that we have in the state. It's kind of like how we work, and then organizing people who have lived experience, because we can't do this work without them. Like, my work should not exist without the voice of people who are housing insecure or homeless at the table and at the forefront. And that was a lot.
That was really good. I appreciate that. Brondalyn, you have some follow-up with that?
Absolutely. So it's like awesome hearing all that you are doing in Chicago, and just for the state of Illinois as a whole. So I will say, for the efforts and work that I specifically have been focusing in the last 4 years, we focus on supporting veterans that have experienced or experiencing homelessness. So there's a program called Supportive Services for Veteran Families that is funded by the VA. And it is throughout the entire United States. And I've had the honor and pleasure of overseeing the Oklahoma program through Goodwill of Oklahoma Industries of Oklahoma, and then also with working with Endeavors here in Texas. And so the focus for that particular program is to really meet the veterans where they are. It's really designed to address the immediate need. So one of the key things that we've always focused on is, assisting them with deposits or rental assistance, really finding and identifying landlords that are, I say barrier friendly, because it's not so much the veteran themselves, it's just things that they may have done or experienced in the past that could bring forth barriers that could prohibit them from accessing housing. And so that's our focus, is to create partnerships and relationships with the communities that we're serving, and get them involved, because just as important it is for the funding to be there, but we have to have landlords and apartment complexes that are willing to rent and open up their facilities to our veterans. And I think one of the other components that often can kind of be overlooked a little bit is just navigating the services themselves. And so one of my focuses as a consultant is streamlining our services and making them accessible and easy for veterans to navigate. And then just, really being there as a supportive network and identifying other community partners. They may have different resources that we can't supply, but making sure that they're at the table so all areas of concern when it comes to housing are being addressed, not just the immediate housing, but transportation and employment and things of that nature. And so that's my little niche for that most part. I do have a little special heart for working with foster care youth that have aged out of foster care. They often see a lot of the same similar barriers that some of our veterans are experiencing. And so making sure that the conversation is being had and just addressing those barriers and issues that those youth are facing, as well as the veterans. But I agree with Naya. There is no way you can do this work without having the voices of those that have lived experience of homelessness or any of the barriers that you're working to address at the table.
Thank you, Brondalyn.
Thank you, Brondalyn.
Oh, there you go.
Oh, go ahead,
I'm happy to jump in. I realize I'm the only one left who hasn't gone yet. And just echoing what Naya and Brondalyn have said, Naya, you said something about housing being a human right. That is the vision of DASH and really the crux of what we do. We sit squarely at the intersection of domestic violence and housing. And one of the facts that most people don't recognize is that domestic violence is one of the leading causes of homelessness in our nation, and certainly worldwide. And the services that DASH provides really fall into the categories of providing home, means, and safety. And so we provide the full continuum of services, from emergency to transitional to permanent housing options for survivors of domestic and sexual violence. And how we define survivors of domestic and sexual violence is really quite broad. So that may be, physical violence, it may be sexual violence, it may be emotional violence, it could be sex trafficking. It really spans the full breadth and depth of survivorship. Our housing programs, our Cornerstone program provides emergency to transitional housing services. It's the largest one in the city, in the nation's capital. Before Dash opened our doors, in 2010 of our Cornerstone building, there were less than 50 available units in the nation's capital dedicated for survivors of domestic violence. And so it's always been our mission to really elevate and broaden the available resources that are made that are dedicated to survivors in the city. And at Cornerstone, survivors are able to stay with us at no cost to them for up to 2 years while they're receiving holistic services. And, Brondalyn, you brought up a word, and I think Naya did too, of navigation. The systems that survivors have to work through are incredibly confusing, and they're confusing for me, they're confusing for all of us who have to know them. But when you layer the level of trauma that survivors have, sometimes generational trauma, it really can take a toll of being able to get what you need. And so 3 words that describe Dash's, all of Dash's services are, and set us apart, is to be low barrier, to be voluntary, and to be trauma informed. When we welcome a survivor into Cornerstone, they again receive the holistic services throughout their stay with us. Some people stay for the full 2 years. Others are able to leave us in 6 months or 18 months or whatever that time frame may be. But it's open and available to all survivors, men, women, children, anywhere in between. Survivors with mental health histories, survivors who may have a history of working in the sex trade. It really spans the full breadth of services and different types of survivors. We also have transitional housing programs, our Empowerment Project, as well as our Right to Dream program. Our Empowerment Project provides housing services for survivors in the district and in the surrounding region of DC and Maryland and Virginia. And we also have a Right to Dream program. Brondalyn and Naya talked about the youth population. One of the areas that we have realized is a really critical need in the city has been dedicated, expanded services for youth survivors. And so we launched that program in August of 2020, right in the middle of the pandemic, to bring on dedicated 20 units for youth survivors aged 18 to 24, and really building the program to be the gold standard for how services are delivered for survivors, youth survivors in the district. That is also for up to 2 years, giving them the dedicated time. Most programs that have existed in the nation when this movement started for survivors were really short term, 3 to 6 months. But you all know, and I know, that it takes years to unpack that kind of trauma. And so we're really proud that we have, again, services that can span that full breadth. We also have flexible emergency assistance funds that can be provided to survivors. That's our Survivor Resilience Fund that serves as our prevention tool, where we're able to work to provide grants to survivors or to vendors that may be working with survivors to eliminate those financial barriers. It can be things like back road rent, security deposits. My car broke down and I can't get to work if I don't fix my car. If I lose my job, I lose my house. Or built things that survivors may need to feel safe, to rebuild their house after the abuse happens, where they may be needing to replace locks, or things even as unique as having a survivor who has a significant mental debt. We had a recent survivor who came to us who had unfortunately been stabbed several times, and having to work with her and our community housing program team to identify medical resources that would be able to not only save that survivor's life, but also get her the cosmetic surgery that would be needed to get her to the next steps in her goals and also in her housing needs. We recently launched a brand new program called Safe Nights Fund that really is targeted to provide emergency financial housing, typically for up to 5 days. The housing market in DC, as you all may know, and probably in Chicago, is quite ruthless. And sometimes this is the difference between life and death, when a survivor is needing to find somewhere immediate until space is available in another program. And so we just launched that this calendar year, and we're starting to see even more need. I believe, have already served 21 survivors through our Safe Nights Fund in the month of April alone. So we're seeing even more survivors coming out with those types of needs, particularly as a result of the pandemic, seeing higher instances of child abuse where the children themselves are the survivors and not necessarily the parents. And sort of driving all of that is our Housing Resource Center, which serves as the hub of access to any of DASH's programs, as well as connection to other domestic violence and domestic violence service resources that DASH may provide, and other housing providers and service providers in the region may have available to survivors. So that is DASH at a snapshot. It's hard to put that into a small bucket, but I'm sure we'll get into more details as we go along.
Yeah, thank you so much for sharing those details, Kube and Naya and Brondalyn, about the resources and the services that you all provide. And then also thank you for the work that you all do for vulnerable populations, especially during these challenging times. And that gets us into our next question. You all alluded to some of the issues that you all face in your position and your organization face. Can you go into a little more detail about some of the housing challenges that your organization faced and continue to face during the pandemic, and which issues have been exacerbated by the pandemic? And anyone can feel free to jump in.
I'll jump in. I will say one of the key things that really stood out during the pandemic for the SSVF program on a
So Brondalyn, you're cutting in and out.
level. Oh, I'm sorry. Can you hear me now? Okay. Okay, so one of the things that we noticed during this process, during the pandemic, was that our processes and our procedures were inadequate. A lot of them were really prohibiting us from being able to provide quality service and care the whole time. And because of the pandemic, we had to go down to what the bare bones or requirements or bare minimum was needed to provide quality service. And then at that moment, it opened us up to an opportunity to serve so many more veterans. And so it was really more of a wake-up call for the SSVF program on a national level, because when you look back at our processes early on, we had a lot of stipulations, some unnecessary restrictions. But at that moment, it was just one of those things that became very clear to us that we can change it and we can do better, and we can provide quality care and services and still meet the requirements without making unnecessary barriers for our clients to get our services. And so that was probably one of the big eye openers for us. And then I would also say that probably one of the bigger challenges is just realizing how uninformed the community is about the services that we offer. So we can teach veterans, we can share that information to some of the veteran community, but the actual community had no clue of the impact of the work that we do and what we can do and how we can work closely with the community to help our veterans. And so that was probably one of our big eye openers. We started hosting what we call our landlord virtual luncheons, where landlords from the communities could come in and learn more about our program, how we work with them, how we can, expedite payment, what's the most efficient ways to move a veteran in and provide services, extra fees that we are able to pay with the funding, with the money that we received through the pandemic. And so there's so many more resources that we've been able to provide, such as hotel stays. So if you have a veteran in your community that is experiencing homelessness, literally living on the street, we can actually pay for them to go into a hotel. Now, we do our best to make sure we make it known that it's not for long term, because our goal is to get you housed, really relocating you from the hotel to your own apartment. And so that's pretty much one of the things that really stood out, is just we have to do better as a program on a national level, just informing all the communities throughout the US what we do and how we can help not only the community, but the veteran as well. And it should be a partnership.
Thank you so much. And Naya, Kube, if you'd like to jump in there to talk about some of the challenges that your organization has been facing.
Yeah, I'll go. So I think as we went to, work from home, like underline that word home. You know, you have your stay-at-home orders, and when you hear that, like, you're like, okay, I'll be in my house for X amount of weeks or, you know, year and 1 month. But for people who are experiencing homelessness, it's like you're telling them to socially distance, you're telling them to stay at home. It's, well, they live in an encampment. So a lot of our work was like reaching out to our governmental officials, really just having a really great connection with our governor and his team, and saying like, these are the things that we're going to need, talking to our Department of Human Services and saying, hey, you know, it would be great if we got these folks into hotels. So our suburban, I will like really just give a shout out to, outside of the city of Chicago, our suburban downstate folks like rented hotels, like hotels were empty at that point, and getting people into those spaces using our state dollars, and using when federal money started coming in, just like saying, we're going to rent out this entire hotel and we're going to put people into it. And I think the great thing about it is that we are seeing service providers saying, hey, we would like to continue this model. We would like to get rid of the shelter, like one big room space for people. Let's try to like buy buildings like this and not turn it into an a SRO, a single resident occupancy. I think that's what that stands for, but making sure that people can have their own space until we can get them into housing, like permanent housing. Another thing that came up, like I talked about, our education piece. Okay, so now we're gonna have kids go to school virtually. Are you gonna provide them with a computer? So our work, we ended up getting funds. Some of our great grant organizations that support us were like, how much do you all need to get laptops for students experiencing homelessness? So they gave us just a lot of funding. We were able to just quickly get laptops out the door to students. And then we set up a mutual aid fund for people experiencing homelessness throughout the state. And just like, again, money comes in, you can donate to it, and then money goes straight out the door. And our team, our organizers really did an amazing job with that. But though, like Bronalyn talked about, like, you just have to change your whole way of thinking. And I think that it really did, as we're talking to our legislators and we're talking to our governor's office and to local alder people, saying this is what the reality is, and we need to shift it because the world is not what it was anymore. And we need to like really put pedal to the metal and put our money where our mouth is, and like in homelessness in a real sustainable way.
I wish I could snap on that. I love it because that's right on target with what we were seeing on the ground at DASH. One of the things that we always say to our team and to our funders and to our family of supporters is you have to give yourself the permission to do things differently and to think outside the box and to be innovative. And I think COVID was a blessing and a curse in that it did that, right? It's devastated our communities in ways that we never imagined it could. But for many of the communities that we were serving and do continue to serve, this wasn't new, right? It just exposed, pre-existing inequities, if you will. And, when we looked at DASH, the major challenges, we never closed. We are a direct service organization. Our headquarters are in the building that we own and manage and serve and house survivors in. And so immediately, as soon as the pandemic launched or hit, if you will, we had to figure out how to keep people safe and healthy and continue to do the work that we do and shift to a hybrid model of being in person and some of our staff being in staggered remote work schedules. And so the first challenge was safety, as always, which is part and parcel of our work. And, I think it also drove home in that challenge that housing is health, right? Housing is part of how we build health in our community. And if we as a community didn't prioritize housing before, we really needed to now, because it became part of the medicine to keep people safe and to keep people healthy. We also, we were one of the first domestic violence housing agency in the city to have a positive case. And so we learned really quickly how not to panic and work through those challenges. Our team was incredible in really rallying to make sure that they kept each other safe, that we had the resources we needed. and that we started to think outside the box of how we provide services. What we do is based on building trust and building relationships with survivors in order to help them move their goals along. We also had to think through how to deal with just the higher levels of trauma happening. I've been telling folks that we dealt with 3 pandemics concurrently. We dealt with COVID. We dealt with the pandemic of domestic violence because people were indoors. Domestic violence became a pandemic of its own with higher numbers and much, much higher instances of DV and higher instances of lethality. We lost a couple of survivors to violence during the pandemic, much higher numbers than we had in past. And so just really providing the emotional support to staff, to survivors in our care, and being able to lean on each other was critical during those times. And funding is always a huge challenge. And, COVID had pushed organizations like ours to really, we had unexpected expenses of procuring PPEs and having to house significantly more people than we had in the past. And so having to pivot very quickly to targeted fundraising efforts, the community really rose to support us. We were able to bridge the gap that we had in our budget. I think Naya talked about the additional funding resources that came through. And I think that was a huge win from COVID of seeing how philanthropy can be different, of the fact that you don't have to wait 6 months to get money out to people who need it. And that you don't need to ask people to give their blood and their grandmother's name in order to receive funding. So it was an incredible sort of benefit, if you will, of challenges that came through COVID, but then the win was seeing that it is possible to do things differently and that we can take a lot of lessons learned moving forward. And, as we continue to do what we do on the ground as an organization, pushing ourselves to see what went really well during COVID, what didn't go so well, and how do we learn from those things is really the lens that we're utilizing currently to move forward in our services. And I've talked about our, Right to Dream program that launched, and also now the Safe Nights Fund. Safe Nights Fund really came out of seeing the need in the community and then having to respond to that in real time.
Thank you so much. I feel so much more well-informed about what you all were experiencing in your respective areas. And you've mentioned so much about the barriers and how you faced them already. Particularly, Kube mentioned how long a client may stay in your housing. And I really wanted to know from that, did in this particular area at this time, did it increase for clients that they wanted to work through the programs more? Did it impact them anyway that they wanted to stay longer, or did it do something different?
A little bit of all of the above. We had several people in survivors and families in our programs who lost their jobs and may have been on the path to maybe they were 6 months from exiting our programs and all of a sudden couldn't because their financial outlook changed. And so they ended up having to stay a couple of months longer than they would have because of the pandemic. We also had some folks who were able to continue on and be successful in transitioning to their next steps. And typically when survivors are leaving our programs, they're either going into, into additional supportive housing or going into purchasing a home of their own, or moving on to another program. So it spans the full scale. I always tell people that a survivor's needs are as unique as your fingerprint. And so whatever one survivor may need is different. What Rondalyn may need is different from what you, Tanisha, may need, or even, male survivors that we currently house in our programs, or LGBTQIA survivors. The other thing that, also changed timelines was the third trauma of the racial and reckoning that our nation has been dealing with, and many survivors that we serve are people of color. And so the additional trauma of what we've been going through as a nation for the last year around racial inequity really took a toll on many of the survivors in our programs. And it may not have been the financial impact, but the emotional toll. I did put some people a couple of months behind schedule.
That's perfect. I just thought that made me think of those things when you all were mentioning that. So moving on to further our questions, what in what ways did the CARES Act actually impact your work? You all have talked about the finances. You talked about looking at philanthropy differently and fundraising, but you know, CARES Act has been a major topic across the US and how monies were actually distributed. So how can, let us know, what did it help? Did it help you all? Were you able to access it easily? Give us the scoop. Rondalyn, you look ready.
Listen, okay, because the CARES Act came a raining. And I will say the funding, it truly allowed us to meet the needs of the veterans that we serve, but it's also allowed us to serve a unique population that we often would miss. And I say that kind of just piggybacking on just your previous question. So one of the services that we were able to provide is hotel stays. Previously, it was very difficult for us to provide any type of hotel stay for a veteran. And because of the CARES funding, it allowed us to work and provide immediate housing for veterans that often would disregard our program because they didn't really want to do all the steps that we set up and we put in place at the beginning. And that is very challenging. It's overwhelming if you have medical issues, if you have mental health issues or barriers, and you're trying to overcome them. And then you have a program saying, well, we'll give you housing, but you got to do all of this right now. And I'm like, that's not fair. It's not fair. That doesn't really give people a realistic response time, ability to stabilize. And so with this CARES funding, we were able to do that. We were able to work with veterans that we may have had street contact with for 2 or 3 years that were like, all right, well, y'all putting us in hotels, let's see. Okay, let's put them in. And then at that moment, it became priority for us to provide a holistic approach where we're looking at mental health, we're looking at medical issues, how are you accessing your VA benefit? And it gave us an opportunity to have a designated space where we could go to them, they would have housing, and then we could meet them, whether it's virtually or even just coming in the lobby, 6 feet social distancing, and we're walking them through the application process one by one. And so I think our overall outcome has been outstanding. The amount of veterans we were able to serve, the amount of housing we were able to provide. Our initial program requirements only allowed us to provide housing or rental assistance for 6 months. And in the middle of the pandemic, 6 months couldn't do nothing for anybody. You're losing your job, resources. And so yes, the CARES funding was significant. I will say it was a lot. It was really easy for our program to access the CARES funding because it was designated to our SSVF program. So the unique component for us as both agencies, the focus was making sure you could justify the need. And we had the numbers, our state's numbers for the state of Oklahoma, especially for Dallas and Dallas, Fort Worth, Killeen, and Waco areas. We also have San Antonio for the Endeavors program. So the numbers and the needs were there. But I think one of the barriers we did have to address is that when we put our veterans in the hotels, we had to be even more diligent about getting them out, because sometimes if you set your clients up in a very comforting situation, it can be too comfortable. And we want to work to make sure that we're addressing homelessness and not so much enabling, but really building them and giving them the tools that they need so they can be independent at some point. And so that's probably been the unique barrier that we've caught on the inside of our CARES funding. But the process was very simple and it was very direct for veterans. I just think, again, I'll say it, we just didn't do a great job letting the community know what was available. And so we got to make sure the word still gets out. There's still funding out there. There's still money out there. So feel free to share. Every state has an SSVF office or a program that's overseeing that. And I will say the SSVF program doesn't just serve the veteran, it also serves the veteran in the family. So if you have a spouse that is pursuing school or trying to get any assistance with employment, we can also assist with that. At children, if they need supplies for school, we can pay for that. Each program has pretty much the same funding or same opportunities available, but it's just depending on how many people have accessed it in their communities in those respective areas. But the money was good. We'll take more.
Yes. I will say it really let us know that like money is fake. It's always been here. It was available. And so as someone who's to the left of things, it was like, see, the money has always been here. You all have just decided when and like how to use it. So yes, CARES money, amazing. ARP money, amazing. CARES money, amazing. And I will say here in Illinois, outside of the city of Chicago, we have seen that money just like it has been used, in my opinion, really well. So seeing like putting money into what we call the emergency rental assistance program, as well as a mortgage assistance program. So we also have a homeless prevention program throughout the state. I think Kube talked about the one that you all have at Dash, but you know, provide like allowing someone to have that opportunity to be able to pay their back rent or rent moving forward, a security deposit, paying for utilities, you know, people having like a little bump in the road. Obviously, like a lot of people, we know that most of the people who are renting here in Illinois are also working service jobs, and they lost their service jobs. So making sure that we could use that money for that. In the city, it was a little different. I think it may have made national news. Use a little bit of our CARES money to go towards the Chicago Police Department. So like a substantial amount, like 200 million. So people were pretty upset about that because we were asking for hotel rooms. We were asking for like housing opportunities. We were asking for vouchers, and it was like, we don't have it. And then a good old FOIA request found out how much we were used to, how much we gave to CPD, I think was a struggle for a lot of people. And a lot of people are still struggling with that decision being made by the city. But yes, CARES money, amazing. People are doing great things with it, and continue as more packages are coming out, as well as those stimulus checks definitely assisted people, and just making sure that people who are coming home from incarceration are also able to access those funds as well as they get on their feet.
I would echo the CARES fund definitely made an impact in the region. Where I think we had some challenges is that there weren't as many funds that were dedicated for domestic violence survivors. And I think that continues to be the case with just the overall housing and support services in DC, but certainly on a national scale. You know, currently in DC, let me make sure I get my numbers right, up to 29,000 beds that are available to individuals and families, only 484 are dedicated to survivors of domestic and sexual violence. And I think we also saw that in the CARES Act. We did get some federal funds passed through on the FVPSA side, the Family Violence and Prevention Services Act, but that was a very, very small bucket. And that was it. That was it. There were no other funds that came through to DV specific agencies to support through the CARES Act. Now, the private side certainly rose up and was able to provide some really critical support through philanthropy, but on federal dollars, not much passed through. And some of it may also be that DC is considered is not considered a state. And so DC did not get a lot of the funding that should have come through to DC as a state, and they were treated as a territory. So some of that money is now will be coming back to the city with the new administration in place. But there was about $750 million that should have come through to DC through the CARES Act that did not. And even less came through for domestic violence specific services. And I think that's, when we look at advocacy, policy advocacy, as well as budget advocacy, that's one thing that we continuously see, that there's not enough prioritization, which means that I always say that your budget is a moral document. When we say put your money where your mouth is, your budget, if it's not in your budget, it means that it's not being taken care of. So, CARES Act was great, but it didn't work so well for communities that were not prioritized. I just want to echo again that, the private side did step up, and the local agencies stepped up to the extent that they were able to. But, for DC, as we look towards the fiscal 22 budget, and now that the city is getting those additional dollars coming back that they should have gotten in 20, and also the American Rescue and the ARP, American Rescue Plan dollars that are coming into the city. Our city budget has been delayed much longer than it ever has been. Typically, the mayor's budget will come out in March, but it will not be coming out until the end of this month. And so we're not looking at decisions being made until probably August or October. So when we advocate for FIPSA dollars or VAWA dollars or VOCA dollars, it's to ensure that when those monies come down, that they can be passed through to organizations like DASH to make sure that we can then serve the rising number of survivors who are coming through our doors.
Yeah, thanks for sharing that. And also just wanted to put a reminder to the attendees, drop your questions in the chat, and then we'll get to your questions toward the end of the event. But I mean, Kube, what you said was so key, is that investment dollars or investing in those resources are so key to addressing a lot of these issues. And just wanted to kind of get from you all what policy changes you believe are needed to address racial disparities, disproportionate impacts within housing. And I know budget and resources are key, and just wanted to talk about some of the legislative changes that are needed to address these issues head on. We can go with Brondalyn.
I would just say, I guess from my experience, I feel like we got to be honest, because I still think sometimes we're playing a game and it's commercial. I think even when we're talking about servicing the veteran community, we know that there's racial disparities within the services that our veterans are experiencing. And they, and we can have all the money in the world that's coming into this particular niche or program, but if it's not serving everybody in an equitable manner, then it's not doing its job. And so we have to be more intentional about that and be honest about those conversations. So I think when we talk about making policy or legislative changes, I think before I can say which particular policies or legislations that should be changed or suggest those, I think we got to have true and honest people at the table, and not just those that are on a commercial context, but also those that are over the pocketbooks. And so when we are dispersing this money and we're being intentional about spending this money, it has to be in the conversation. I think one of our other panelists just said, like, if it's not in the budget, it ain't real. Like, if you're not deliberately putting this in the budget to say we want to address these inequities that we're seeing in our programs, then I don't know if you're genuinely trying to address it. I know you may want to do it on a heartfelt level, and I think we all move with our heart as much as possible, but there's a ways to put actions to it. And then I would also just add, in a general aspect of working in the social service field, we often are exposed to trauma, but I don't think everybody is operating from a trauma-informed lens. I think sometimes you have policies and legislations that are written to fit the requirements or whatever people may consider as a practicality to address these issues, but it's not trauma-informed. And those don't always align. And so we need to make sure we're walking in a trauma-informed component of, if we're going to require certain things or ask something of a client, is this appropriate? Is it necessary? Is it in the best interest of the client? Is it going to, do we need it to run the program? Is it necessary? And I think sometimes people kind of miss that. So that would probably be more of a procedural or program change, I would suggest. Just being more intentional about being trauma informed from the moment a client walks into your door to the moment they exit your program. And then even when they leave your program, there still needs to be trauma informed residue sprinkling around everywhere. Like, everybody needs to be on that path. So that would be my suggestion.
Yeah, I'll go next if that's okay. So one of the things that's come out of new policies has been like pandemic EBT, so public benefits, SNAP for food stamps, as some people call it, for families, making sure that all kids have free lunch, free breakfast at school. It's these things that could have been done on March 1st, but once March 7th or March 14th happened, it was like, oh, this is a great idea, we should do it. Like, so making sure that we continue policies like that. In my role as the Director of Equity and Transformation at CCH, I get the opportunity to say that homelessness is caused by racism. The reason that we have homelessness in this country is because of racism. If we look at redlining, if we look at how predatory lending, if we look at slavery, if we look at mass incarceration, if we look at the GI Bill, if we look at all of these things, it leads us to where we are today. And so if we're not willing to say that and really unpack it, and I know people are attacking critical race theory left and right. Every state has a bill that wants to don't teach our children that this country is built on racism. It's if we're not willing to acknowledge those things and then work to take this piece of yarn that is so tangled up and really take the time, if you got a gold chain and you've had to untangle it, it's these moments. We need to untangle these things that have happened in this country and say, why is this program set up this way? Why is temporary assistance for needy families for cash assistance for people who are living in extreme poverty at the most $300, $400 for someone to make their rent, to be able to buy shoes for their children, to be able to buy transportation? When we created those policies, welfare reform, people had a picture of what someone looked like who was on welfare. And so that's why we decided that you have to jump through all these hoops in order to get public benefits. This is why you have to jump through all these hoops to get housing, because it's built on, it's this Black woman with umpteen children. And so we want her to live and be punished for all of her decisions that she's made in her life. And now as we're in 2021, we're having these conversations and we're saying, you know what? White people are poor too. Maybe we should open these services a little bit more. Maybe we should take these programs and remix them so that as we're thinking about the war on drugs, maybe we don't take those same steps that we did when we were talking about crack and heroin in the 1990s. So that's one place. In Illinois, I will say big shout out to our Black caucus at the state level, moving pillars that talked about economic opportunity, talking about criminal justice reform, talking about access to housing, and I'm forgetting one of the pillars, please forgive me, but really saying we need to do structural changes here in Illinois because the state has done harm. We have a responsibility to change that harm. And so they worked really hard, and who knew it was going to happen? They did. And they got these pillars passed and had the governor sign them to be able to really do substantive change and try to move us from this place of being stuck of well, I don't know what to do about this, but putting pen to paper and really moving the state forward. So yeah, that's what we need for going forward. Oh, and I will talk about two pieces of legislation I'm working on right now. We have when the feds created welfare reform, they included a provision that said if you have a felony drug background that you are not permitted to receive SNAP or TANF when you come back into the community. So states have been pushing us towards removing that barrier. You have to do an affirmative piece of legislation. So I'm currently working on a piece of legislation here in Illinois that would remove that barrier. It got out of the House and is now in the Senate. Fun times. And then I'm working on a piece of legislation that will expand McKinney-Vento to college students, because we know that students who are in college are saying we need that liaison that we had in high school. We need priority in housing. We're tired of telling people our traumatic stories. And that person then says that they can't help me, have one person on campus who can provide assistance and guidance through this work. And that one has made it through the Senate and now is in the House. And we're hopeful that that'll get signed. But making sure that if we're telling kids that they need to seek, or people that they need to seek higher education, making sure that they have the services that they need once they're there, and the scaffolding, so that as you're building that building, they have all of the tools that they need. That's it. That was a lot again.
I love it. I will add that there's not much I can add, but I will say, from a DV perspective, the reauthorization of VAWA was key for us, the Violence Against Women's Act, and I just keep going back to the funding perspective of making sure that there are federal dollars that make their way down. Similarly, something else that's new or reemerged, appropriations were brought back this fiscal year, and so the Congresswoman Norton on the DC side made her selection. Stash was one of the agencies that did get one of the community awards, and domestic violence was one of her priority areas. There were at least 3 domestic violence specific agencies that received those community awards from Congresswoman Norton, and I think that should really serve as a guide to the federal government and certainly on the local side to make sure that we continue to prioritize domestic violence as a resource. On the local side, I will say DC currently has a bill around indirect cost rates for nonprofits. Many nonprofits do not get indirect cost rates allocated to them, and if they do, it's maximum 10%. Which, as you all know, when you talk about NIA building the infrastructure, organizations are consistently starved in order to do the work that we do. And Rondalyn, to your point, trauma-informed work is expensive. In order to be trauma-informed, it means you need to invest in your people, in your front line, in every single part of the organization. And so you cannot deliver, champagne services on the beer budget. And when we talk about, y'all know I got lines, but when we talk about being able to deliver services for survivors, but really across all social services, particularly housing, it's important to invest on the front end, because if you don't, especially from a racial equity lens, these survivors and families and individuals will have to come back 3 or 4 times. And then it costs you that much more to do the service. Whereas if you just invest in the front end, you're good.
This has been amazing, ladies. So much information. We do have one question that has come in on Q&A, and they asked the mention about limitations usually being posed by the grantor of funding. They find this frustrating when they're reaching those people in poverty. So they're asking, how do you address or overcome that particular issue? Anybody?
I think this, okay, go ahead. I'm gonna be real quick, I promise. The question talking about the finite level of poverty, and it's like when you have clients that probably just meet that borderline, that if they made $2 less, we could help them. And I think for me, the eye opener for the pandemic, with this pandemic for sure, is that if we can change our policies and procedures so quick to address the pandemic, I don't see why we can't do it for this. I just don't understand, and I understand, of course, we're dealing with federal and state agencies. So to me, that at this moment, if we know that this is a common barrier that we're experiencing when we're serving our clients, and I will say for me, it's very hard, because I can have a veteran that can come in, it's him and his wife and a child, and both of them are working, but they're working low income jobs, and they're really trying to move up or trying to apply for other positions, but they literally are $50 over our income. So then I have to look at it like, okay, well, I can't serve you, but I also make it a mission for our clients for us to know the other programs and resources that are in the community to connect them in the meantime. So that's the immediate solution, is knowing what other resources are available, because there are programs that will help people that may not meet the low income barrier standards within your certain area, but there are programs that can help assist in different ways, such as, and I would say also add community partners. I think sometimes working with certain local churches, that they don't traditionally have an income requirement in certain capacities, so they can probably volunteer and help in that aspect. So that's my immediate concept or immediate solution. But then the other solution is, how do you get with the other nonprofits and organizations in your community and make this a legislative change? Like, clearly, this is something you're constantly running into, and I'm confident you're not the only one. I'm sure other organizations are running into the same barrier. So at that moment, it's like, well, how do we start a small committee, just have a small conversation, bring in a local senator, local House representative, to see what we can do to make this a legislation change, just for our area? Because I will say, depending on what area, state I'm working in, or what state I'm working in, this barrier comes up, but maybe not as often. But this is definitely something that can be addressed in a solid solution. I hope I answered.
Yeah. And I was just gonna say, with funders, like we need to have conversations with funders. And I know this is super hard for us to do because they keep the lights on, but they've removed all of the red tape. Oh, you don't need this 10-page document where I explain like my life history to you and who are all the people who are working at the organization, and you can just push money out the door. Okay, what's the difference between, again, March 1st and March 15th? Like having those conversations with our funders, I think that, you know, a lot of funders posted like statements of like, Black Lives Matter. Well, if they matter so much, can you please stop having us fill out all of these reports and actually be able to be boots on the ground to be able to do the work? Like, give us the money, trust us, like that we're going to do the right thing with the funding, and that we are going to have changes. And I think a lot of funders struggle with this idea of just giving people cash. And I think that's just the thing. Like, even when you're talking about people who are experiencing homelessness, you'll have it on the micro level, people saying, well, I don't give money to people who are on the street because they might buy alcohol. Like, they're experiencing homelessness. Maybe they're self-medicating. Like, you don't have a right to tell someone. I don't get to tell Comcast how they spend my money, or AT&T how they spend my money after I give it to them. So you don't have the same right to do that. But I'm getting off on a tangent. Anyway, we need to have conversations with our funders about like getting cash out the door and how that is okay. And if they are setting up these foundations that is built on the wealth of where? Black people, that they need to make sure that we're able to do this work well.
Yeah, I will add, you know, for Dash, when we are looking at our services as executive director, if I have a legacy to leave at the organization, is that we are just as incredible in our mission as we are in our margin. So I get it. I get that there's a need to make sure that your internal controls are in place, and organizations do have those in place. And you know, I always, as a potential solution, also ask people, ask your funders to show you the guidance, because a lot of times these barriers are self-imposed. It may have been someone who made a statement 5 years ago that said, we can't do this, and then somehow it became the law. Show me the guidance. Where is it? And if it's not written down somewhere in some law, then you can change it. It's a practice. So what is practice? What is process? What is procedure? And what is policy? If it is policy, then back to Brondalin's point, then absolutely work to change the policy. But if it's not a policy, then it is within your purview to change it and deliver the services that you know is best.
Yeah, absolutely. And I feel like we all could talk for hours on this issue. And again, really thankful for the insights that you all have provided, and just wanted to ask if you had any wrap up words or last parting words that you'd like to share with the audience. And also, you know, maybe some ways that folks can get engaged on addressing a lot of the issues that we talked about today. We can go with Naya.
Yeah, I will say for the audience, like, find the people who are doing the work. If there's a piece of legislation that a legislator wants to move, or a priority, it's, you know, love ideas. Like, we have legislators who just watch the news and then they file bills. Great, awesome, love having to clean those up. But if you can, reach out to the people who are doing the work and like see how things are. Like, does this make sense for our community? Is there a difference between, you know, this happened in California, you want to do it here in Illinois? Is there a constitutional issue? Like, just, you know, reaching out to us, because we love having these conversations. We love making systematic change, and not, you know, and yes, it's important to impact one person at a time, but if we could change the world for 500, 600 people with one signature of the governor, that's amazing.
Yeah, I echo that, and just really grateful for the time with you all today. And if anybody wants to learn more about Dash or what we do, you can find us on the web, And, you know, it's just, I think, a big takeaway for me from COVID and really just doing this work, which is really high burnout work, is I'm tired. I'm tired of us suffering. I'm tired of us suffering when we don't have to. America is not a poor country. America is a greedy country. And we have the resources that it takes to change it. If you just look at the collective power that is on the 5 people on this call, the lives that are touched by these 5 people is incredible. And the change that only the 5 of us can make, and then you add all of our attendees. So please lean into your power, lean into what you do, and take care of yourself. Pause when you need to, breathe when you need to. And if you need to step away, do so too.
First off, let me just quote, America is not a poor country, it's a greedy country. That will be my tweet for the day, and I may share it for the next week, just to constantly remind people, these are the facts. Like, that's just where we are. I think the 2 things I wanna leave you guys with is that there is no one size fit all to addressing homelessness. And so everybody has something to bring to the table. There's ample amount of solutions that we should be open and receptive to. So do it. Do the work. And I think that's the big thing. And I think my second thing is everybody doesn't have to be a leader. Sometimes we all just got to be a teammate, and we carry our part. And so if you can't, you know, write legislation, that's not your thing. If you're not interested in the whole political process, you can go volunteer at a soup kitchen. You can donate. You can go to Walmart, buy a bed set and some dishes and help somebody move into their new house. There's programs and resources in your community that you can assist youth that are aging out of foster care, that are aging out into homelessness. There are youth that LGBTQIA youth that are experiencing homelessness. If you have a special demographic of person that you want to serve and help, if you are a survivor of domestic violence, there are community organizations that you can also go to and give back. I am adamant about, for those that have had lived experience, including myself, we have to give back. We have to use our voices, and we have to be present. And at that moment, that's when we can make even lasting change. We can make generational changes. And so the information you guys got here today, take it and use it. You know, I know so many times I've sat in on Zooms and I went to meetings and I'm jotting these good notes, and I'm like, please make sure I apply this somewhere else, because this is too powerful, too informative. And truthfully, it's just too much Black girl magic for y'all not to share it somewhere. So come on. I mean, we out here. Okay. This melanin is popping. All right. Tune in.
Thank you so much. This has been amazing, ladies. I just want to wrap up. We have done amazing on our time. It is 12:02 Central Time, since we were right at an hour. I just want to say thank you so much, Naya, for bringing up the Black Caucus and how they actually work in Illinois. In so many other states, they are working. And we have to give homage to those members, yes. And that's another reason why we support and celebrate NBCSL for creating this affiliate, the National African American Legislative Staff Coordinating Committee. I know we're gonna work on that acronym, y'all. We're gonna work on it. At any rate, thank you so much, everyone who has stayed throughout the extra minutes of our hour. And please follow us on Facebook to get more information. We will be having more series come to you soon. Thank you, and have a great rest of your day.
Thanks, everyone.
Thank you.